What does Diabetes UK do to help people who are diabetic?
I mean, they've got a range of literature which we have copies of, and when we do our awareness events, they're available, and they're also available from myself. They provide one booklet for type 1, another one for type 2, basically introduction on how you manage those conditions. And then there's others, recipe books, there's a variety of stuff, and foot care. And then obviously on the website themselves, they've got various articles of stuff that they're doing research. And then you've got the bigger activities that they run for their own fundraising.
Having type 2 diabetes, how did stress or anxiety affect your blood sugar?
Well, for me, it was stress rose the blood sugar quite high when I was having problems which led to spinal injury, not diabetes related, but when I was 4 and over, as well as obviously the blood pressure was high, but so was the blood sugar scale quite high. So yeah, stress and that anxiety does affect blood sugar, and as a result of the spinal cord injury, I do suffer from anxiety from time to time. So yeah, it does affect your blood sugar.
People who have type 2 diabetes, how does stress affect their sugar levels?
Yeah, again, if you're highly stressed, then you risk obviously your sugar levels going up. And then quite often, I find when you're stressed, you start eating things that are probably not the most healthiest things, which again put on weight and put on more pressure onto the organs and stress onto the diabetes. And you probably are less active anyway.
How does diabetes stigma affect people's mental health?
Well, I think particularly with type 2, sometimes people blame someone who's got type 2 diabetes, saying it's their lifestyle that's caused the diabetes, which is not true, because there's a number of hereditary reasons why you can develop type 2 from your parents having it, your ethnic origin. It's not all about the lifestyle. But yeah, there has been a stigma, well, it's because you're eating too much or you're drinking too much and you're not taking enough exercise, you cause the problem. And obviously that can cause people to have low esteem and depression.
As someone who has diabetes type 2, is remission possible?
It is a possibility. I mean, I went into remission, but quite a drastic way of doing it. But I know colleagues on the team have gone into remission by basically changing their diet and increasing exercise and working on things that are causing, basically trying to lose the weight, which is how I got rid of mine. So yeah, it's possible. You need a lot of support, and you need your GP surgery to be backing you on remission, not just use of medication, because I personally am not on diabetes and medication at the moment.
So what tips would you give for a healthy lifestyle?
I would say watch your diet and try and get some exercise if you can. I mean, it's a little bit difficult for me with mobility problems, but the average person should, like you mentioned earlier, about the 30 minutes in the park, walking for 30 minutes. When I had a spinal cord injury, I would walk sort of 30 miles in a lunch break. We work in the office, and then make a point of going out to lunch to pick my lunch up from the local shop. And that usually was about 15 minutes each way, plus your time in the shop. So used to help with that. And that did reduce the stress levels, did make you a bit healthier.
Can you share your journey and experiences having diabetes type 2?
I developed type 2 in 2014. Basically, it was managed by a little bit of diet, metformin. And then in 2023, I get 4 and over, ended up visits to the hospital. While they were doing tests to find out what was going on with my spinal cord, I developed an infected appendix that made me critically ill, and as such I stopped eating properly, and then I went from sort of 18-20 stone down to about 10 or 11 stone, and obviously lost with diabetes along with the protein, so it had to build up the weight again. So it was a very drastic way, sort of critical units, and nearly died as a result of it. But yeah, it was a very severe way of getting rid of the diabetes, but it's not the journey I would recommend to everybody.
How do you stay motivated and manage diabetes?
It's basically trying to manage your time, manage your stress levels, and not be tempted to snack too much and drink too much, and give yourself time.
With diabetes, what advice would you give for a newly diagnosed person?
And then we can obviously give you some more advice from the team that have type 2 or type 1, depending on which one you've been diagnosed. We've got a mix of both. Most of type 1s have had theirs since they were very young and had it a number of years. So certainly they can help with the newly diagnosed. It is a very scary place to be in because when I was diagnosed in 2014, there wasn't a lot of information available by the GP surgery. I had already been in contact with the local group for diabetes through another organisation. So I got in touch with them and they provided me with a lot of literature from Diabetes UK, which provided information about managing diabetes. And then from that, I joined the local group, attended some events, and then eventually got more actively involved to where I am now.
So with your glucose levels back to normal, how do you feel mentally?
Yes, I think mentally you feel okay. You can tackle anything. One thing with type 2 diabetes is when the sugar is really low, it's like a car engine run out of fuel. You feel you can't do anything. Whereas if it's managed well, then you can challenge most things.
Or someone who thinks they might have diabetes,
is to go and see your GP and get a test done, and the blood test to see whether or not you actually have got diabetes. Because if you do have diabetes, and then obviously set you upon the medication and route you through to us, hopefully. There is on the Diabetes UK website a risk manage, know your risk, which you can put in various information about your back. So you fill those questions in and that will give you a score, and that score will then tell you if it's low, you're fine, don't need to worry. If it's medium, you might need to go and consider talking to doctors. If it's high, then it should produce a letter that you can send off to your doctors to arrange a referral. So that would be my first protocol is to get the test done, your age. So if you're a man, and obviously gender. So for example, a man over 40 is higher risk than a woman over 40, and then you've got the family history. And we also know that from an African or Asian background, you're also a higher risk than the European.
When people are diagnosed with diabetes, they often have a lot of fear.
Getting hold of the information you can about diabetes, contact the local group to get the support and involve your family and friends. We try and organise things so that when we run events for the partners as well as the individual who's got diabetes, because the partners need the support as well. They're supporting you on your journey with diabetes, and they need to be supported as well so they understand what diabetes is about and what treatments are required. Okay, Zach, can you tell us about your role at Sappho Care and what it offers the community?
So I'm the CEO of Sappho Care, a charity dedicated to helping the community live healthier and a more active life. At Sappho Care, we believe that everyone deserves the tools, support and opportunities to improve their well-being and lifestyle. We offer a range of services including workshops, events, seminars, community engagement activities. Our focus is on supporting the community. We also help reach minority groups and working with organizations that face barriers such as language difficulties or limited access to local communities. By breaking down these barriers, we help people connect, grow, and lead healthier lives, physically, mentally, and socially.
Having diabetes, what long-term effects can it have on mental health?
Living with diabetes can make you feel stressed, tired, or even sad. You have to constantly check your blood sugar, take medication, eat carefully, and plan ahead every single day. This ongoing effort can be mentally exhausting and sometimes overwhelming, especially if things don't go the way you want. You might also feel worried about the future and your health problems, or you feel like no one understands what you're going through. These feelings can lead to anxiety or depression if not addressed. Taking care of your emotions is just as important as managing your blood sugar.
How can poor mental health affect diabetes management and blood sugar levels?
When your mental health isn't good, it becomes much harder to manage your diabetes. If you're feeling very down or anxious, you might skip meals, forget medications, or avoid checking your blood sugar. You may not have the energy or motivation to follow your diabetes plan. This can create a cycle. Poor mental health makes diabetes harder to manage, and poor diabetes control makes you feel worse emotionally. That's why treating mental health issues is a key part of keeping your diabetes under control.
What is diabetes distress, and how does it differ from a clinical depression in people with diabetes?
Diabetes distress is the emotional stress that comes from dealing with diabetes every day. You might feel tired of checking your blood sugar, upset when your numbers are off, or frustrated when the demands of managing the condition. Many people with diabetes feel this way from time to time. Depression, however, it's more serious and long-lasting. It affects all parts of your life, not just your diabetes. It includes constant sadness, lack of interest in things you enjoy, and trouble eating or sleeping. While diabetes distress can improve with support and better care, depression may need professional treatment like therapy or medication.
Okay, diabetes can cause many emotions, but how can someone tell if it's diabetes distress or clinical depression?
Diabetes distress is usually linked to how you're managing your condition. It comes and goes based on how you feel about your care. It might improve if your routine becomes easier or you get more support. You may still enjoy other parts of your life. If you're clinically depressed, the low mood doesn't go away. Even when diabetes is going well, you might lose interest in everything, have trouble sleeping or eating, or feel hopeless. If your feelings are lasting more than 2 weeks and affecting all areas of your life, it's a good idea to speak to a doctor or mental health professional.
For people living with diabetes, what mental health symptoms should signal the need for professional help?
You should try and get help if you're feeling sad, hopeless, or anxious most days, especially if it lasts more than 2 weeks. Losing interest in things you usually enjoy, feeling tired all the time, or having trouble sleeping or eating are also signs to watch out for. If you're finding it hard to manage your diabetes because of your emotions or you're avoiding care altogether, that's another warning sign. If you ever felt like life isn't living or worth living, it's very important to seek help right away.
Does NHS guidance include mental health screening in diabetes care, and when should people expect it?
The NHS encourages checking your mental health as part of your diabetes care. At your appointment checkups, your doctors or nurse may ask how you're feeling emotionally and offer support if needed. Sometimes they use simple questionnaires to see if you might be dealing with depression or diabetes distress. If they find something concerning, they may refer you to a mental health services. If no one has asked you yet, it's okay to bring it up yourself and ask for further information and support.
Beyond Diabetes UK peer support, what official mental health support is available for people with diabetes?
We at Psychotherapist, who work closely with many organisations such as Diabetes UK and Balance of the Mind, we can help with physical and mental health conditions. We can also help people living with diabetes overcome barriers such as language, and within minority groups, we provide information, referrals and access to free counselling sessions. We offer assistance and information. Through these partnerships, individuals can connect with health professionals and therapists who are part of the care teams. These professionals are trained to support the emotional challenges that come with managing diabetes, including other physical and mental health conditions.
How can people cope with diabetes burnout and support their mental health?
One helpful tip is to remind yourself you don't have to be perfect. It's okay to have off days. Try setting small goals and celebrate the little wins, like checking your sugar once a day or taking a short walk. Taking breaks from tracking every single number can help reduce stress. Talking with others who understand, like support groups, can make you feel less alone. Also, doing relaxation activities such as deep breathing, meditation or journaling can help calm your mind. Most importantly, don't be afraid to ask for help.
Diabetes can affect mental health. What risk factors make people more vulnerable?
Certain times in life can be more difficult for people with diabetes. Teenagers and young adults may struggle with managing diabetes while trying to fit in with friends. Pregnancy or becoming a new parent can be also very stressful, especially for those with diabetes. Major life changes like retirement, illnesses, or dealing with diabetes complications can affect mental health too. Other risk factors include feeling lonely, having money troubles, or already dealing with anxiety or depression. Being aware of these changes early in life can help you take action early.
What self-care methods support both blood sugar control and mental health?
Stanford University research has shown that taking a daily 30-minute walk in parks or green spaces can reduce stress by up to 70%. Simple habits can both support your blood sugar control and mental well-being. Regular exercise, good sleep, healthy eating, and testing which foods increase your blood sugar levels. Going for a walk and same bedtime routines can make a big difference. Mindfulness, yoga, and relaxation techniques, deep breathing, meditations can also reduce your stress levels. Taking time for yourself, being kind to yourself, and asking for help when needed